Welcome back to Tech and Titanium. I'm Dexter Maddox, an oral surgeon and the founder of IMvision Dental. We've made it our mission to help implant surgeons demystify the complexities of implementing technology to aid in practice management. In our current series, we're providing an inside look into the transition from WinOMS to Sensei, our new practice management software. We aim to offer transparency, share real-life experiences, and help answer any questions you might have regarding such transitions. We're not affiliated with Carestream in any way. I just wanted to share our experiences with my colleagues. In this third episode, we're going to delve into the heart of our practice operations, the front office. We'll cover the ins and outs of patient scheduling, treatment plan entries, check-in, check-out, as well as how patient calls and communications are handled within the system. The front office operations form the backbone of any dental practice. They often are the first touch point for our patients, so efficiency, accuracy, and ease of use of these systems are crucial for smooth patient experience. Furthermore, these systems play a significant role in staff efficiency, clinical coordination, and overall practice productivity. From scheduling patients to managing treatment plans and ensuring seamless communication, we're going to break down how Sensei handles it all, as well as the hiccups we've encountered along the way. Brooklyn is our fearless leader in the front office, and we'll talk about her experiences so far. All right, can you describe your initial experience with Sensei scheduling system? How does it compare to the previous system of WinOMS?
I think initially it was a challenge. We had to switch from scheduling based on what they were coming for into scheduling with codes. So that has been a transition, but overall the scheduling process has been easier for us.
How has the process of entering treatment plans in Sensei been? Can you share some of the features that have helped or any challenge you have faced?
The treatment plan process has also been a challenge just because you have to enter treatment plans based off of the fee schedules, which has been a challenge for us, but I believe with time we will be able to get our treatment plans in there easier with adjustments in Sensei.
Are there any specific features in Sensei that make entering those treatment plans easier or harder than WinOMS?
I think the fee schedules have made it harder. Once we get our system organized and able to get all the insurances in Sensei, we will be able to enter treatment plans in easier.
So can you explain a little bit more about how the fee schedules work within Sensei?
It's based off of the insurance and what fee schedule they use, so you have to enter codes in based off of that fee schedule. So if you aren't aware of the fee schedule you're using, it can throw off the estimates within Sensei.
So let's talk about check-in and check-out procedures with Sensei. What's the difference between Sensei and WinOMS for check-in and check-out?
The check-in process is a lot easier in Sensei than it was in WinOMS. It's easier to see when the patient is here, when they're seated, because they have different cues. In WinOMS, there was just the point of care, which was harder for us to use, but it has made it easier in Sensei. And as far as the checkout process, it also has been a lot easier, but the codes are still a challenge for us.
So what specifically is easier about the check-in process within Sensei? Is it just having those different cues at the top of the application?
Yes, the cues have made a big difference in patient processing. It's quicker to make sure the patient gets to the back quicker, and that process has been easier.
Can you explain how documenting patient calls and communications in Sensei works?
Yes, so you can actually put it into the appointment notes, so you're able to track when that patient has called based on that appointment, as well as in their chart. There's only one location for notes. In WinOMS it was in multiple locations, so it was a little harder to find, but they're a lot easier based on the appointments.
Is it easier to communicate with the clinical team in Sensei compared to WinOMS?
Yes, for sure. There's a lot more spots and locations, like the cues that you're able to use to communicate with them back and forth. But I think there should be more communication that they should work on with the back.
What specific communication do you think would be helpful to have between the front and the back office?
Some type of docking system. We used to have a docking system in WinOMS. There is not one in Sensei. It did make it easier to send patients to people so they could follow up with them, but there is not one in Sensei currently.
Looking at the overall transition to Sensei, what have been the most notable effects on our front office operations?
I think the overall process for the patient experience has been a more positive experience. I think the billing side and the charging side has been the most challenging part for us, just because the process has been from scratch. So once those are entered, I think it'll be a better system. But overall, I think it's been a better experience for us.
Do you think Sensei has overall been an improvement on the practice, or do you wish we had stuck with WinOMS?
No, I think it was a good transition to Sensei. I believe Sensei is better than WinOMS.
And I know you did a lot of the training for the application. Are there any sort of techniques or anything that you noticed during the training process that were either difficult to teach or difficult for people to learn, or tricks that you used to make the transition a little easier for the front office team?
I think the training within Sensei itself wasn't the best experience. I think their training process could have been easier to help new people who are in Sensei learn better. But on our end, I think this once you learn the steps, it's a lot easier to train it. I think if Sensei would train people a little better, the training process would be easier on everyone.
Is there anything you do differently with that training process, kind of with that hindsight of having gone through it?
There was many different people who trained on different subjects. I think if they had videos that we could reference and one trainer that we could ask questions to, it would be a better process.
If you could rate Sensei out of 10, what would your rating be?
Currently a 7. There's some things that need improvement, but overall I think it's been a lot better.
Thank you, Brooklyn. The process of transitioning these fundamental aspects of our practice to a new software system has been a journey with plenty of ups and downs along the way. One thing remains clear throughout: change is always a challenge, but it brings opportunities for growth and improvement. We continue to adapt, learn, and find new ways to enhance our operations and patient care. In our upcoming episode, we'll delve deeper into our clinical experience with Sensei. Stay tuned for more insights, experiences, and real-life lessons as we continue our journey. If you found this episode valuable, don't forget to hit that like button and share it with your colleagues who might benefit from this information. And if you haven't already, make sure to subscribe to our channel for more insights into the world of dental tech. This is Dexter Maddox from IMvision Dental signing off. As always, stay curious, stay informed, and keep innovating. See you in the next video.